The Medical and Dental Council of Nigeria has disclosed that only 58,000 doctors renewed their annual practicing license in 2023 due to brain drain in the health sector in the country. The Registrar of the Council, Dr. Fatima Kiyari, disclosed this during the induction oath-taking ceremony of 20 newly qualified doctors at the Edo State University. According to her, the council has so far registered 130,000 medical doctors to practice in Nigeria since its inception 61 years ago, adding that the council is mandated to regulate the practice of medicine, dental and alternative medicine in Nigeria. For this conversation, we are now joined by President of the Nigerian Association of Resident Doctors, Dr. Dele Abdullahi. Dr. Abdullahi will also discuss what the dearth of doctors portends for Nigeria's healthcare system and how to reverse the trend. Good to have you on Newsday. Thank you so much for joining us.
Thank you very, very much. Good to be here.
So, Dr. Abdullahi, let's start, with a report from the MDCN that only 58,000 out of 130,000 medical doctors renewed their annual practicing fee in 2023. What does this mean for our healthcare system?
Well, thank you very, very much for having me on the studio. The statement accredited to the MDCN registrar, represented by the deputy registrar, is actually an acknowledgement of a fact that we've actually put forward a long time ago. For people that have been conversant for a very long time, our association that represents young doctors in Nigeria, especially the resident doctors, house officers and medical officers below the level of principal medical officer, have actually over time pointed it out that we have a dearth of workforce in the healthcare system. Now, to put into proper perspective, any doctor willing to work in Nigeria, either trained within Nigeria or trained outside, will register. But it is only those that are within the country that are practicing on a yearly basis that will be renewing their license. So the statement accredited to the registrar only points to the fact of the total number of people that have shown interest to work in Nigeria and those that we have on ground. And I also have to put into perspective that the fact that we have 58,000 licensed does not mean we have 58,000 on ground. For doctors that are outside the country that wish to come back later to come and practice, they will also be renewing their license. So the dearth is actually worse than what is being portrayed, but we are hoping that we can have a form of improvement in periods after.
Wow, that's an outstanding number, and also you put it in such a stark way, but I want to ask about the recent reports. Well, it's not very much recent. It's been happening quite a bit, but there were reports of doctors and medical staff being assaulted or not feeling safe within their place of work. Are these part of the issues that cause doctors or medical personnel to jackpot, so to speak? If you can also discuss some of the challenges that they face within their workspace.
Thank you very, very much for this question. Well, you should understand that it's a vicious cycle. Like the association has pointed out a long time ago, there are a lot of factors that are making healthcare workers to leave the country. We actually brought up the push and pull factor, the factors outside the country that attracts doctors. And if you notice, I'm not using the term young doctors. I'm talking about doctors generally. Because if you look at all these recruitment exercises, it's no longer the young doctors alone. We have even professors leaving the country. And there are also factors that push it. And assault within the healthcare system is a major factor that is pushing our doctors out. Since the beginning of this year, a research that we did showed that within the space of January to April, of these 57 hospitals that responded to us, over 44 have experienced a form of assault, either verbal or physical. And it's quite sad. We've actually pushed out these details to the different areas, and we are hoping for response, especially from the security agencies. For those that were keen, of recent, we had a majority leader of the House of Assembly in Kogi State leading a troop to the Federal Teaching Hospital Lokoja to actually attack the facility. And so when we have even the biggest of us within the society not giving the sacredness of the hospital its due course, then we actually have a problem. Now, this assault is not the only thing that is pushing doctors and other healthcare workers out of the system. The working environment is not encouraging. The remuneration is poor, to say the least. Yes, I have to say the current Ministry of Health has done a lot to try to improve what we have. And we've had a very good relationship, and we are hoping that they can actually achieve more. But we need to start facing reality that more has to be done. We cannot say thank you and well done until we've achieved the best. And that is what we are calling on. And we are happy that even the regulatory bodies are beginning to acknowledge what we've been saying for a very long time, that we have a dearth of manpower. We are losing healthcare workers from our system, especially doctors, and even the ones we are producing are not willing to stay within our system.
Now, that's really very sad. But some analysts are of the opinion that there can be no improvement in our health sector if we do not curb medical tourism amongst our elites, especially public office holders, first. What are your thoughts on this?
Well, for medical tourism amongst our elites, I think curbing it is a good way to go, because if we have our political leaders using their facilities, then when we describe the state of our facilities, it will not just paint in an image that looks like a movie to them. It will be things that they are seeing. I could remember that once when we had a form of grievance within a hospital in the North Central, a senator actually came in, and what he saw was far more appalling than all the reports he has gotten. And it actually resulted in mild improvement, not really major, and we're actually hoping for more improvements in that region. What we are hoping is not just about curbing the medical tourism, because we need to understand that even if we curb the medical tourism, we might get an improvement in our facilities, but it still doesn't stop the healthcare workers from migrating, which is their due right. What we need to do is finding ways to convince these healthcare workers to stay within our system. How do you convince these healthcare workers? You have to improve their remuneration. You have to look at their work hours. There's currently a movement on most of the social media spaces on the number of hours the doctors are working. I'm sure no reporter will want to work 72 hours. Most doctors work beyond 72 hours when they say they are on call, because what they have to do is they will first have to pick up the duty from maybe a Saturday morning or a Friday morning, and by Monday morning they have to resume their normal duties, for which they will have to work till their closing time, which is most likely 4 or 5, or in most cases when the last patient leaves, because as a doctor, you cannot leave your point of duty until everybody that is seated to see you has been taken care of. What is the federal government doing to properly remunerate these doctors for this period of extra work they are doing? How are they hoping to take care of the welfare of these healthcare workers for the extra work they've done?
Well, Dr. Dele Abdullahi, the president of the National Association of Resident Doctors, we've brought up quite a few topics this afternoon, and we sincerely hope that some of them will be addressed in order to make sure that we retain some of our best doctors within Nigeria. Thank you so much for joining us for this discussion here on News.